In Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
And he's not afraid to be our guest in the studio today. Welcome, Professor Dietrich Andresen, a cardiologist from Berlin. Hello.
Hello.
When a patient suffers a heart attack, usually there's some obstruction going on in the coronary arteries. And with the broken heart syndrome, the coronaries are clear, but the symptoms seem to be the same. How's that?
Well, the symptoms are similar, are identical. The cause is different, namely the occlusion, the blocked coronary artery by a thrombus. On the one side for the heart attack, on the other side it's a shrinking, contracting of the vessels, but the results are the same, namely that the heart muscle doesn't get enough oxygen, and therefore it doesn't pump as it should. And this is the same situation in heart attack and the same situation in broken heart syndrome.
If the symptoms are similar, can a patient distinguish between a heart attack and a broken heart syndrome?
No, he cannot. And the doctor as well. He cannot. And if you get a call and say, well, I have pain in my chest, and so you cannot differentiate, you cannot distinguish between a heart attack, pain, and pain due to broken heart syndrome. Thus, the answer is clear. You have to go immediately to the hospital and they will decide by a catheterization what is heart attack or a broken heart syndrome.
And sometimes a heart attack can be fatal. Broken heart syndrome can be fatal as well?
As well, because the problem is, the fatality is that you abruptly can get arrhythmias, ventricular fibrillation. So the heart is suddenly stands still. And then you collapse and will die immediately if nobody is there for resuscitation. So the outcome of the patient could be the same.
But how can you treat it? I mean, as a cardiologist with a heart attack, you can just put a stent into it, a catheter, and dilate the arteries. But how can you treat broken heart syndrome?
Well, in a patient with broken heart syndrome, we are happy because we know that in 95%, 96%, the heart will completely recover. However, at the time, it takes about 2 weeks or 3 weeks. But in between, within these 2 weeks, you have to treat the heart as well with medication against heart failure. And then the recovery will occur in about 2 or 3 weeks, and then everything is okay again.
And does it always need an emotional shock to lead to broken heart syndrome?
So to be honest, we don't know whether this is the case. However, if you ask the patient with broken heart syndrome, did you have any stress in the past? They would say yes. But if this is the case in the future, we don't know. But again, yes, violence, domestic violence, for instance, or the death of the husband and so on, is in the history, occurs in the history, so the patient might develop, because of this stress syndrome, broken heart syndrome.
Professor Andresen, a racing heart or tachycardia can be quite scary for doctors and patients. What problems can arise out of that?
It depends on how fast the heart is beating. And if the heart is beating 200 per minute, the patient can collapse, can feel dizzy, and can come unconscious.
And it's not always due to emotional problems. That kind of structural heart diseases can lay behind it. What kind of diseases can be behind it?
Well, there are different diseases, genetically, diseases which is in your heart. There is the feeling that sometimes it can occur this heart beating can occur abruptly, and the patient feels these symptoms very badly.
And we got a viewer question from Costa Rica, Nansen E. Lorenzen. He's 57 years old, and he says when he watched the World Cup finals, his heart was beating very, very fast, tachycardia, and he was sweating, and he had some chest pain. Is this dangerous?
First of all, I would say this is normal because it was so exciting, the World Championship. But on the other hand, I'm a little worried about the chest pain he's complaining of. And it could be that indeed during the heart is beating faster, he gets problems with the coronary artery, so with the blood flow in the heart. So I would strongly recommend this patient to go to the doctor, and he would check, for instance, by an exercise test, by a treadmill, ECG, so we can find out whether this is psychologically effect or just really a heart attack.
But many patients have problems with their doctors, actually, because the doctors don't take this kind of problem seriously, and they just blame it on emotional stress, like the World Finals. So what can the patient do about this, and how can this happen at all?
That's a pity. I would say you should change your doctor.
Yeah, right.
That's the clear answer.
But why are doctors thinking like this? Why are they thinking like that?
Well, they don't listen to the patient what they're telling you. And if they would listen, the history and what the patient tells the doctor, he would say, well, this could be really a heart attack or a coronary artery disease rather than just a psychological effect or trauma.
And you as a cardiologist, I mean, you're dealing with heart diseases and not so much with emotional problems, but how can you distinguish between emotional problems and structural heart disease?
Well, I make a so-called exclusion procedure. So what I do is just to check whether this patient has an organic disease or not. And I do this very carefully. And this is advice to all doctors to do this. Before you answer and say, well, dear patient, you don't have an organic disease rather than a psychological or psycho-emotional effects. Some effects are there if you listen to the patient and he tells me that he has no zest for life anymore. He doesn't play guitar any longer. He doesn't meet with friends. He doesn't read newspapers. These are hints. These are factors which lead to a psycho-emotional stress situation. And so you have, again, see, well, maybe the patient needs other help rather than organic.
Yeah, and after you rule out structural heart disease, is there a special kind of treatment for emotional heart disease, or is it always a psychiatric care?
If the patient is in deep depression, well, this is psychiatric asked, and you have to check and see whether there's good good medication and other therapeutic possibilities. However, if the patient is a little bit sad, a little bit anxiety, you can just by having physical activity, making exercise, running, it improves your mood immediately.
So encourage for
and
a
increase your quality of life. So I encourage the patient to make physical activity.
So it's always a teamwork between cardiologist and psychiatrist. Professor Andresen, thanks so much for being with us in the studio today. Thank you.